Hey everybody, Alan Weber here, Friday afternoon from the Mayor's Office. Thank you for tuning in. Thank you for listening. Thank you for everything the people of Santa Fe are doing through what has been an extraordinary week. This is a week unlike any that I've ever experienced, and I'm sure most of you have never been through anything like this either. This is a week when we are all asked to do new things, let go of old habits, embrace new ways of working, new ways of responding, new resilient efforts, new community activities. We've had to let go of many things that we take for granted. We've had to let go of going to our rec centers and going to the mall, taking our kids on outings. We've had to really recognize that we are in an extraordinary moment and that we need to react with great courage, great compassion, great resilience, and Santa Fe is coming through with flying colors. So before I get into anything else today, I want to say thank you to those who are out on the front lines, the city workers who are amazing, the county team that is working incredibly hard, the state folks who are in there every single day trying to process things and make things better for everybody in New Mexico, to the people of the city who are responding with great compassion and courage and understanding that we are not in the good old days anymore. We are out of normal times and into unusual, extraordinary emergency times. This is a time when we all need to live our values. We need to take care of each other. We need to take care of ourselves, stay healthy, stay well, stay focused, try our best to see our way through an unprecedented global challenge. So thank you to everyone who is working so hard. Also, a special word of thanks to our nurses, our doctors, our healthcare professionals, people who are out making sure that the rest of us are able to come through healthy and with the care we need. Our hospitals are on extraordinary pressure and extraordinary stress, and we should pause a minute and send our thanks to them as well. I want to talk a little bit about where we are in an ongoing process and review some of the actions that have already been taken, share with you some notes I took yesterday from a platform engagement where more than 200 mayors from around the country were briefed by policy experts, public health experts from around the country, and give you some of that input from them. But first, let's review what the governor has done this week. With great courage and with great strength, she looked the problem in the eye and decided that decisive, strong action was taken. Restaurants now are closed except for takeout or delivery, and our economic development team, led by Rich Brown, is beginning to develop a web site where you can learn which of your favorite restaurants still offer takeout or delivery, so we can support them and help them make it through this crisis. She shut down the malls, she shut down the bars, she shut down spas, basically limited gatherings to 10 people or fewer. And we need to respect that. We need to understand that the single most important thing any of us can do with individual responsibility is to stay at home to the greatest extent possible, practice social distancing, continue to do hand washing and sanitizing. If you do go out, run an errand and come home. Try not to contact other people. It's very important that we respect, as Santa Feans and as New Mexicans, the unique position that we're in. Thanks to the governor's fast response and strong response, I believe we have a higher per capita testing of any state in the country. But even that won't mean we're immune to the spread of the virus unless we observe her order to stay home, not practice getting together, but practice social distancing. We've got to slow down and interrupt the spread of the virus. We've got to flatten the curve. and I'll say more about that in a minute. Here in the city, we took the action of free parking on the city's lots and garages and the street. The lodger's tax, we've delayed collection because we know the incredible financial and economic stress our tourism industry, hotels and motels are under. We want to do what we can to allay that pressure. We've put a suspension on evictions for those people who can't pay their rent because of the extraordinary crisis we're in. Doesn't mean we're in a rent-free period. People will still owe the rent, and they wish the landlords in town should still continue to expect to be paid the rent when their tenants can pay in the future. In the meantime, tenants and landlords need to talk to each other about what's possible, what's doable, what's reasonable in a time where normal is no longer the case. We guaranteed people that if they could not pay their water bill, again, water isn't free, but we won't be turning people's water off. We're trying to do as much as we can to continue the delivery of city services while minimizing interpersonal, person-to-person contact. We're asking people to do business over the web or over the phone or through the mail. Try not to go to City Hall. Try not to go to the utility to pay your utility bill. Try not to do things with cash, which can carry germs. Think about ways to do new things that keep us safe but get the job done. That's what we're attempting to do, to innovate in land use, in our public utilities, in our finance department. We're looking to keep business going while changing the way we do business to keep everybody safe. We're asking people to self-quarantine. If you went out of state on a vacation and now you're returning, please take 14 days at home. Make sure you're not bringing anything back from wherever you were visiting. I sent a letter today out to the airport to be delivered to people, both commercial and private plane arrivals. A letter saying, welcome back if you're coming home, welcome if you're visiting. Whether you're visiting or coming back, if you are out of state, please take a staycation. Go home for 14 days. Make sure you are safe yourself. Make sure that your family, your friends, your neighbors are not going to be introduced to the coronavirus because of your return to Santa Fe. I've heard from Mayor Keller, incidentally, anecdotally, that the substantial number of people in his part of New Mexico who have the virus came through the Sunport. So let's try to be careful. If you came through Santa Fe Regional Airport, if you're driving home from a trip you took out of state, do the right thing. Do what's best for you. Do what's best for our community. A 14-day self-quarantine will help interrupt the spread of the virus. If you're feeling sick, if you think you might have the symptoms of the virus, and they are on the web, you can find them on the State Department of Health website, on the City of Santa Fe website. Don't go out. Stay home. Call the hotline, 24/7 hotline, and get an assessment over the phone to see whether your symptoms in fact match the virus, and then if they do, follow the directions to get a test. We need to be able to know who does or doesn't have this disease, and sometimes, to be clear, you are asymptomatic, but you may have it, and that's why staying home, social distancing, is the single most important thing to do. That said, there are some amazing things happening in our community. I want you to know how many people in our city are rising up to help each other. I was on a video platform, video conference yesterday with about 30 people from around the city who are looking after food resiliency across Santa Fe. Public schools are still handing out grab-and-go breakfast and lunch without contact, but with the passing of the food through a window or being left at a door. Something like 1,000 participants per day, 14,000 bags set out in 7 different locations. Our good friends from YouthWorks have 20 to 30 young people ready to go to create meals and to distribute them. Kitchen Angels standing by, ready to feed Santa Fe. The Food Depot has meals they're providing and giving out. 2,300 people fed through the Food Depot. 1,200 bags of food every other day, and $200,000 worth of food so far in storage, with volunteers safely distancing themselves, providing food to people all across the city. If you want to help, don't forget to contribute to the Santa Fe Community Foundation Fund. It's on the Santa Fe Community Foundation website. That money will go to nonprofits like the Food Depot to get the food they need to distribute to the people in our city who are hungry or would be hungry if they weren't getting that kind of assistance. Meals on Wheels is reaching out to our seniors. So there is an amazing network here in this city of volunteers, of nonprofits, of people from all walks of life looking after other people from all walks of life to make sure we look after, take care of each other, but don't spread the virus. I was on a platform, another video conference yesterday with about 200 mayors from around the country. And I thought I'd share with you some of the things that came up from all over the United States. First of all, an expert from the Johns Hopkins University again made the same point. The single most important issue is social distancing to slow the spread and flatten the curve of infection. We have high-risk populations. If you're a senior, if you have a compromised immune system for any reason, all the more important to stay home. And there are people rallying to the cause to help you. If errands need to be run, they can do that for you. This is all on the city's website and across Santa Fe, an amazing outpouring of compassion and community. We need to look after those who are in nursing homes, those who are in assisted living, make sure they get what they need, and look after the children of the people who are our first responders, our doctors and our nurses. They have children too. They're out there on the front lines taking care of us. We need to take care of them. Now, here is a stunning statistic that tells you why we are seeing cases spike around the country. 1 week ago, according to the experts in public health, 40% of Americans didn't take the coronavirus seriously. They believed it was a hoax. Friends, it's not a hoax. This is the single greatest public epidemic health threat perhaps ever, certainly since 1918 and the Spanish flu. This is sweeping around the world. And there are 3 things, 3 levels of responsibility that we all have to take. First, we all have to take personal responsibility. What can I do to make a difference? Sometimes the single most important thing you can do to make a difference is just to stay at home and not to go out except for errands that have to be run to get food in the house or medicine in the medicine cabinet. But personal responsibility belongs to all of us. Then there's institutional responsibility. What can institutions do to make a difference? How can our employers help, our nonprofits, our educational institutions? What can institutions do to help their employees and also to extend their facilities to the community? And finally, the public sector, city, county, the state, the school district. How do we work to shut the virus down, to shut the spread of the virus and slow it down? Those are the 3 levels of responsibility. We all are working at one or more of those levels. What happens next? These next few days will be perhaps the most significant for Santa Fe and New Mexico. whether we see a surge like has happened in other countries and other cities where people didn't stay home, didn't practice social distancing, and so the curve went from flat to a huge spike. That is the moment we're in right now. That is the issue for slowing down the spread of the virus. And it's going to be a matter in some cases of logistics, making sure that our hospitals and our healthcare providers have the masks and the other protective gear they need, the other facilities they need to take care of us. But remember, if you do feel sick, don't go to the hospital, stay home and use the hotline. That's what will make a difference. Now, this is a problem unlike any other emergency we've seen. That's something that came through loud and clear from all the other mayors on this briefing session. If you think about what we faced a year and a half ago when there was a flood, that was an event that we knew how to handle. There was a flood, there was a cleanup, there were insurance claims, there were people to be taken care of. It was a linear process. Here we're dealing with something where we really don't know how it's going to end or how soon it's going to end. We don't really know what the cascading effects will be. There's an immediate healthcare issue, but then there's the economic, the social, the other fallout that we have to follow as it ripples across Santa Fe. We need to get our heads wrapped around the idea that this is fundamentally different, and so we have to act differently. We have to assume that everything we do matters, that all the steps we take now to slow down the spread of the disease now will make a big difference in the future, in the weeks and the months to come. And that's the new understanding that makes this emergency so fundamentally different from something like a flood, where we have an actual timeline and a logical way to intercede and help people. This is about each of us helping each other by staying home and flattening the curve. There's a lot of new things that we're all going to be trying. Virtual meetings. Next week we'll have a virtual city council meeting where no more than 10 people can be in the city council chambers. And so the council members will be phoning in and the public will be listening in and able to comment, but in a completely different way than we've ever done before. We're all going to have to try new things, practice new habits, develop new ways of communicating. City government is no different. Our land use department still trying to process permits, but doing it without person-to-person contact. Our water utility still asking folks to pay their bills and get help when they need it, but not doing it person-to-person, doing it over the web, over the phone, through the mail. It's an unusual experience. It's uncomfortable in many ways, but it's a test of our character. It's a challenge to our community to learn new ways of getting old things done. And what I'm seeing around me every single day, from our economic development team, our folks in the community services area working with seniors and young people, families, our tourism department trying to shore up the hotels, the motels, the summer markets that we're so accustomed to having, now having to invent new ways of doing these things. People are incredibly creative. People in Santa Fe are amazingly resilient. So keep thinking of ways to get our city into a new place where we're all healthy, where the things we love about Santa Fe, the outdoors, the sunshine, the trails, the ability to live in the most beautiful place on earth, are not sacrificed, and we still stay safe, we still stay healthy, we take care of ourselves by keeping separate, staying home, and being safe. That's the message for today. It's been an extraordinary week. I see no reason to think that next week will be any less extraordinary as these events, these unusual emergency conditions continue to evolve. So stay tuned. Check out the city website. There are resources there for moms and dads and grandparents and aunts and uncles to use to play games and read books and entertain the kids. There's lots of advice and tips on how to stay healthy, but basically what we all need to do is take the steps to slow the spread of the virus, flatten the curve, stay healthy, stay home. I'll see you next week. I'll keep these briefings going as this continues to evolve. I'm looking forward to a safe, healthy weekend. Enjoy the outdoors. Stay away from too much interpersonal contact. Remember the governor's rules about a limit of 10 people in any one place. Remember that we are all in this together. We are all going to come through it together. We're all going to take care of each other together. Thanks for listening. Thanks for all you do for Santa Fe. Take care of yourself, take care of your family, take care of the community. Let's all take care of Santa Fe. I will see you next week.